Hello, good afternoon. Welcome to my YouTube channel. Today's video title Sushruta Samhita, the ancient Indian medical masterpiece that changed the world. Imagine a time over 2500 years ago when there were no modern hospitals, no x rays, no antibiotics, and no advanced surgical equipment. Yet in, yet in ancient India, a remarkable physician was performing complex surgeries, teaching anatomy, reconstructing noses, removing cataracts, and emphasizing hygiene long before these ideas became common elsewhere. His name was Sushruta, and his extraordinary work, the Sushruta Samhita, is regarded as one of the greatest medical texts ever written. Today we will explore the incredible wisdom of the Sushruta Samhita, why Sushruta is often called the father of surgery, and how his teachings continue to influence modern medicine. Who was Sushruta? Sushruta was an ancient Indian physician and a surgeon who is believed to have lived around the 6th century BCE. He studied under the legendary physician Dhanvantari, who is revered as the god of Ayurveda. Unlike many scholars of his time who focused only on theory, Sushruta believed that medicine required practical experience. A surgeon, according to him, should learn through observation, repeated practice, and careful study of the human body. His life's work became the Sushruta Samhita, one of Ayurveda's foundational texts. What is the Sushruta Samhita? The Sushruta Samhita is far more than a medical book. It is a complete guide to health, surgery, anatomy, diagnosis, ethics, pharmacology, wound care, nutrition, and medical education. The text contains detailed discussion on human anatomy, surgical techniques, plastic surgery, fracture management, eye diseases, childbirth, toxicology, hygiene, medical ethics, preventive health care. For its time, this was an astonishing achievement. The father of surgery. One of Sushruta's greatest contributions was surgery. The Sushruta Samhita describes more than 300 surgical procedures and around 120 surgical instruments, many designed specifically for different operations. These instruments included scalpels, forceps, needles, props, scissors, hooks, and surgical knives. Many resemble tools still used in operating rooms today. Plastic surgery. Perhaps Sushruta's most famous achievement was reconstructive surgery. In ancient times, criminals sometimes had their noses amputated as punishment. Sushruta developed an ingenious techniques to reconstruct the nose using skin taken from patients' forehead or cheek. This procedure became known centuries later as the Indian method of rhinoplasty and inspired modern plastic surgery. Even European surgeons studied these techniques many centuries afterward. Cataract surgery. Sushruta also described a method for treating cataracts. Using a fine instrument, he carefully displaced the cloudy lens to improve vision. Although modern cataract surgery has evolved significantly, his work represents one of the earliest documented eye surgeries in history. Understanding human anatomy. Sushruta insisted that every surgeon must understand anatomy before performing any operation. He encouraged careful study of the human body through observation and practical learning. For his time, this emphasis on anatomical knowledge was revolutionary. He believed that skill without knowledge was dangerous, while knowledge without practice was incomplete. Surgical training. One of the most fascinating aspects of Sushruta Samhita is its teaching methods. Students were instructed to practice before operating on patients. They learned surgical skills by practicing on fruits, vegetables, leather bags filled with water, animal tissues, and other suitable materials. This resembles today's stimulation based medical education. Importance of cleanness. Sushruta understood that cleanness played a vital role in healing. He advised surgeons to maintain clean instrument, clean surroundings, and proper wound care. Although germs had not yet been discovered, these practices reduced the risk of infection. His attention to hygiene demonstrates remarkable medical insight. Medical ethics. Sushruta believed that a physician's character was as important as medical knowledge. A doctor should be compassionate, speak truthfully, respect patients, maintain confidentiality, continue learning throughout life, avoid greed, treat every patient with dignity. These principles closely resemble many modern medical ethics. Prevention is better than cure. The Sushruta Samhita emphasizes maintaining health rather than merely treating disease. It recommends balanced nutrition, regular exercise, good sleep, personal hygiene, mental discipline, seasonal adaptation, healthy daily routine. Many of these recommendations align with current preventive medicine. Global influence. Centuries after its composition, the Sushruta Samhita was translated into Arabic and later reached Europe. Its surgical knowledge influenced physicians across a different civilization. Today, historians recognize it as one of humanity's greatest scientific achievements. Medical schools around the world continue to study Sushruta's contributions to the history of surgery. Lessons for modern life. The Sushruta Samhita teaches timeless lessons. Knowledge must be combined with the practice. Compassion is essential in healthcare. Prevention is better than treatment. Lifelong learning leads to mastery. Science and ethics must always work together. Cleanness saves lives. True healing involves both the body and mind. These lessons remain as relevant today as they were thousands of years ago. So, the Sushruta Samhita is not merely an ancient Ayurvedic text, it is a treatment to human curiosity, scientific thinking, and compassion. If you enjoyed this video, please like, share, and subscribe for more inspiring stories from history, science, philosophy, and ancient wisdom. Thank you for watching.